Well, if I'm not talking about my practice or my patients, you'll hear me talk about my grandchildren and my pets. They take up a lot of my time. I'm also a knitter. I have more yarn in my house than I'll ever use in a lifetime. I have 4 or 5 spinning wheels, and I make my own yarn, and I do woodworking as well. Endocrinology was an academic challenge for me. Every patient that I see, I have to think about. I also have a strong connection to diabetes. I have several family members who've suffered and succumbed to diabetes. And so impacting patients' lives in regard to that disease was very important to me. Primarily in our office, we see diabetic patients, I would say about 70%, but we also see thyroid disease, and that's a big part of my practice. We see other endocrine disorders such as pituitary disorders and adrenal disorders as well. We treat men with low testosterone. We treat women who have estrogen problems. My philosophy of care is more of a goal. And my goal is to approach my patients every day, diagnosing and treating their endocrine disorders in an evidence-based fashion using a collaborative system. Now that sounds very cold and dry, but what I mean by that is that I want to diagnose and treat my patients in a scientific-based fashion, reducing both the risk of complications of their disease as well as reducing the risk of the treatment itself. But the most important person in this collaboration is the patient themselves. In endocrinology, particularly in diabetes, what the patient knows and what the patient does regarding lifestyle choices is often more important than what I can do with my prescription pad. When I see a patient who comes in and they've made lifestyle changes and they are positive about that, when I see what a patient has taken on themselves and done, that to me is the most rewarding part of my practice.